Hey everyone, and welcome to today's webinar titled 16 Key Telehealth Learnings to Prepare for Maximum Success in 2023. My name is Brooke. I am a Junior Marketing Coordinator here at Mend, and today I have the privilege of joining Matt McBride, CEO at Mend. Matt, how are you doing today?
Brooke, I'm doing great, and this should be a really good presentation. I know we had a lot of folks register, so should have a lot of folks in attendance and should be a really good webinar today.
Excellent. I'm certainly excited. Let's go ahead and jump to the agenda for today. The agenda is packed with information to maximize the productivity of your telehealth program. Matt is going to take us through some industry data and then discuss the 16 key learnings. Finally, we'll round out today's webinar with a Q&A session. Starting now, you can use the Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end. Let's get started. Telehealth and patient engagement often go hand in hand, and one way to understand how is to evaluate the value propositions for the stakeholders. Matt, can you walk us through the differences in value props from the perspective of key stakeholders?
Yeah, absolutely. And I think, from a telehealth perspective, we all have a lot more experience and understanding of this now. But, from the patient side, I think the access to care, the convenience, it really shows in the no-show rates. You see single-digit no-show rates. So I think this is something that patients are really looking for and they value, and just seen it had an impact in so many different types of situations for clinicians. I think there are a number of different clinicians that are looking towards telehealth, maybe to have more of a hybrid work model we've seen in certain cases, be able to just increase compliance, increasing access to care. There's better patient engagement in their care, so their ability to really drive outcomes or better manage certain conditions becomes easier, and a little bit easier to even have more frequent touch points when necessary, or provide care in all types of new settings. So lots of benefits there. And then from a C-suite perspective, I think just being competitive. This is something that people are looking for, driving operational efficiency and productivity. So, driving those no-show rates down is something that telehealth is really good at. And just, as consumers think of themselves more as a customer instead of a patient, they're looking for these options and they're wanting these conveniences. And so being able to offer these, we're seeing high patient satisfaction ratings as well, which is going to be very important for driving loyalty and lifetime value. So there's really a win all the way around by offering more modern touch points for patients and offering these conveniences.
Telehealth adoption often comes down to satisfaction. Put simply, if patients or providers don't like it, then it won't have much impact. What is the data saying about how telehealth is being received?
Yeah, absolutely. And for those in attendance, we've got we're going to cover some of the information that we've covered if you've attended some past events, but we're going to have a lot of new information and new insights as well, like this slide here. So there's a lot of sources. There's a lot of organizations that have been conducting surveys, from the government to different consulting agencies, organizations like Triple Tree and others, and the studies are pretty consistent. So you see 76% of consumers are interested in using virtual care. 95% of providers plan to offer more virtual care. One that really stood out in this particular survey, 71% of seniors were likely to use telehealth again, and 98% of seniors had a favorable telehealth experience. My parents kind of fall into that category. They're on Medicare, maybe a population you don't think would be that open to telehealth, and they really enjoy it. And they're not necessarily particularly tech savvy or anything along those lines, but it's really been interesting to hear their experiences firsthand. And so I think there is a strong case for the majority of folks that there is a preference for telehealth if that's a quality means of receiving care. In this survey, and you see it in maybe slightly different percentages, but 36% might leave their physician for somebody who offered telehealth. So I mean, that's a third. That's a third of patients where loyalty is at risk. That's, I think, got to stand out to any healthcare organization. And then, hospitals expect to use it more. Large employers believe that healthcare, that telehealth is adding value for the care of their employees. So again, I think there's been tons of surveys, and the data is very consistent with some of the results we're seeing here.
Now we are going to transition into our 16 key learnings and how organizations of all sizes can run a highly productive telehealth program. Before we move on, we wanted to ask our first poll question. What is your current no-show rate for telemedicine visits? The poll question should be appearing now for everyone, and we'll give you all about a minute to answer. And once everyone is done, I will share the results with all of you, and then we'll begin our 16 key learnings. See quite a few responses coming in right now. Give everyone about a few more seconds to answer. So it appears that a majority of you are saying you're either not sure or about 10 to 15%. Matt, what are your thoughts on the responses to this question today?
Yeah, well, for those that aren't sure, we can measure it, and we're going to cover some of those data points that we're capturing, so we could help you measure that. And for those that are in the 10 to 15% range, we're definitely going to cover some items that might be helpful. There's definitely opportunities, and we average single-digit no-show rates. First thing I'd look at for those people is might not have the right contact information for everybody where you're trying to conduct telemedicine visits. So we'll dive into some of these details in the presentation. And so I think that's a really good response. And I think the folks that are in attendance are going to get a lot of value from this presentation today.
Thanks, Matt. Telehealth is extremely powerful when organizations can set clear goals. Matt, can you help explain why and what are some key goals people can review in their process?
Yeah, I think this is important to, before a healthcare organization kind of even considers the solution that they're going to use, before you even talk to somebody like Men, what are those goals? What's the problem you're solving? How do we define that problem? How do we measure and track against that problem? And we're a very data-driven organization. We're going to share some data and show some different reporting and whatnot that we have. I think, you set those goals, we're going to be able to help you measure, track, and see the trends against those goals that you set. But on this slide, here are some of the goals that we do see from organizations, wanting to reduce no-shows, canceled, improve compliance and outcomes. Maybe you want to leverage your valuable resources, your providers. Maybe you want to leverage those providers across different locations. maybe you want to expand geography, or maybe the payers need to support folks in rural populations. You can expand, business hours. There's even opportunities maybe to eliminate some of the work you were doing free before, attract and retain providers. We've seen organizations have provider wait lists that have gone mostly virtual. And there's other benefits here on this slide that we'll share with everybody after the presentation, but set those goals, carry them all the way through. They should be measured, tracked, 5 years into a telemedicine program. But those goals need to be front and center.
Telehealth isn't for every type of appointment. Matt, what are some of the common problems and types of visits organizations can leverage with a telehealth protocol?
Yeah, so definitely looking at appointment types that have high no-show rates. Maybe there's points in care where you see compliance drop off. There could be, with the coming out of the pandemic and it calming down, and maybe it's heating up a little bit. That could be a need in another area. And then folks might be dealing with populations that have transportation or other types of barriers to care. So I think really honing in on some of those areas, some of the low-hanging fruit where you can drive value quickly to your organization. Those are good areas where we see a lot of people focus. And then, of course, you want telemedicine to be safe. So, here are the types of visits that you could also apply it to, right? If you're doing medication management, the diagnosis is known. Follow-up visits, same type of thing. The diagnosis is already known. Lab results, chronic care management, providing therapy, pre or post-op care for any type of surgical procedures, group education and wellness. And there's other types of care as well where you don't have to be hands-on, but establishing that clinical protocol with a clinical team in your organization. When is it safe? When does it make sense? When does it improve care or improve the experience for the organization and the patients? Really defining that protocol is going to be key for having a successful long-term program.
When establishing a telehealth program, organizations should examine operational considerations from end to end. Matt, what should our audience be examining?
Yeah, so really you want to think about everything from marketing and, a new patient, or how you attract patients or retain patients, all the way to billing and maybe follow-up visits from there, and everything in between. So, and we're going to dive into some of these, but who's going to be involved in the program from various members of staff, providers, scheduling, what type of appointment types that we touched on the slide before. Are people going to call? Are they going to self-schedule? Like our system, does allow for patients to schedule themselves. Is it going to be integrated? What's the workflow going to be like for providers to start visits, see when patients are online? And then all the way through to how does it get coded? Does anything change there around how you're documenting the visit, perhaps documenting where the patient's physical location of the visit was to make sure they were in the state where the provider is licensed to, anything that might be required or changed from a billing perspective. But really looking at that whole journey through the organization is going to be important.
The public health emergency isn't going to last forever. How should organizations trying to stand up telehealth think about legal issues?
Yeah, so where we stand today, the public health emergency was extended again through January 11th of 2023. And the president has said he's going to give everybody a heads up prior to the PHE expiring. Now, some legislation was passed that extends most of the telehealth waivers 151 days beyond the conclusion of the public health emergency. So it's not like everything is going to expire when the public health emergency ends, but there is the 151 days. CMS has put out some guidance recently. For example, in behavioral health, they've talked about, we'll do the 151-day extension. You don't have to see somebody in person, but after, we're going to start requiring some of those in-person visits again. And, a lot of that could change between now and then. And we probably won't see permanent telehealth legislation until midnight of that 151st day beyond the public health emergency. So that creates a little bit of uncertainty. So for the organizations that want to alleviate some of that uncertainty, negotiating directly with payers, right? Just the rates you want, if you can negotiate those and have those in your payer contracts. That's how pioneers before the pandemic really accelerated their telehealth program. So that's always an option to just eliminate some uncertainty for your organization. And if you want to follow and stay informed on a lot of these updates that I'm talking about with some of the new guidance that CMS put out and the 151-day extension and all of those things, stay up to date on anything billing related, all things telehealth, you want to go to Center for Connected Health Policy, a government funded website. They put out great updates, great webinars, and they have great emails that'll keep you informed. Definitely subscribe to their email list. And then the last item on this slide, HIPAA and being able to use tools that are non-HIPAA compliant is still technically in place during the public health emergency. And that's likely going to change. So you definitely want to make sure that your organization is thinking about a HIPAA compliant solution, a solution that is secure, not only from sort of a regulatory and compliance perspective, but consumers care about their data, they care about their privacy, especially with healthcare matters. So you don't want to lose customers over that either. You want to have a system that's secure, communicate that you use a secure tool, and be sort of future-proof your organization for some of these changes that could be occurring sometime next year.
Organizations and providers want to help patients. Matt, how can organizations set expectations so more visits are successful?
Yeah, and we're going to have a great slide after this one that will allow you to be more targeted. But the more you can set expectations with folks, especially folks that are new, if you have folks using a system and they're comfortable, maybe that's a little bit different. But even if everything works smoothly, right? Everything goes according to plan. It was easy to connect all these different things, right? For your providers, if the patient is walking around the grocery store in a noisy location, the audio, video, all that could work and be great, but that could just be very distracting. So not only do you want to maybe set the stage for, how they're going to connect, what types of things ensure a successful visit, but also what type of setting do you want them to be in. Maybe, we've seen some customers, their providers prefer that their patients be on a desktop if they can, instead of being so mobile. You want to think about these things and communicate these things and really set expectations with your patient panel, especially when they're booking an encounter. So they feel like they know what to expect. And then also you've set all the expectations to ensure that everything happens successfully and goes, works for your providers and so on and so forth.
Mend is a platform that works on very low bandwidth connections, but some small percentage of people can still struggle. What is Mend doing to be more proactive?
Yeah, so we actually just released a report and this is available to Mend customers, and it is a forward-looking report. We're looking at all of the video visits, and we're assigning a risk score between 1 and 5. 1, 2, meaning they're 1, 2, 3. They're probably not going to have any issues connecting. 4s and 5s, there could be some trouble for those folks, and maybe you want to set expectations for those folks. And we're working towards creating some more automated interventions based on these risk factors. But we have the forward-looking reports to look at appointments in the future, look at have they had successful video visits in the past? What was their bandwidth like in the past? Have they completed forms before successfully? Do we have contact information on file? Are we able to even send them a link? Obviously, that is an extremely high risk of an appointment that is likely to be unsuccessful. So we have this data available. We are assigning risk factors to appointments. We have made this reporting available in our platform, and we're going to be looking at new ways to leverage this data in 2023 for our customers.
Making sure clinicians have optimal connectivity is extremely important. Matt, how can customers use Mend reports to monitor provider connections?
Yeah, and I do see we've got a number of awesome questions coming in, and we're going to move through the material, and we'll definitely have time at the end, and we'll address all these questions for those that are sending questions in. In terms of the provider connectivity, there's one clear point that I want to make. If a provider has an issue connecting, it could affect all their appointments, right? They could go off and start using FaceTime. So we provide the reporting. We can look at all sorts of data for you. We provide this data in our portal as well. You can look by provider, by device, by browser. What was their average bit rate over a period of time? So in this example, you can see we have a provider averaging 300K a second. It's not going to be a problem. The system's going to work flawlessly, but sometimes there are folks lower than that. Or, maybe that's just inconsistent with, you can sort of see all these other providers have much higher bandwidth. It's still an opportunity to be proactive and just make sure that provider side is solid. And so any successful telehealth program, you want to have this data. You want to be working with an organization that's also looking at this data and making sure that the providers are in good shape to have successful encounters with patients.
Billing for telehealth and virtual visits can be complicated. What are some of the basics?
And we will share the deck, so everybody can reference this slide if they need to. I think most organizations and billing companies are familiar with billing telehealth. However, changes do happen. There have been changes in the modifiers. CMS just put guidance out today saying, hey, at the end of the 151-day extension for mental health, we're going to be looking to, have the 6-month or the 1 year in-person visit. And then there's, exceptions to that rule as well. This is a very fluid time in terms of, the government and everybody really in all these healthcare organizations trying to figure out a telehealth. So go to the Center for Connected Health Policy, jump on their email list, and that'll really help you stay informed and stay on top of any changes as they occur in this very sort of fluid environment that we're in.
In our next section, we are going to cover some tips, tricks, and best practices. But before we move on, we wanted to ask our second poll question. This question is, rate the quality of your connectivity from your current telehealth platform on a scale of 1 to 5, with 5 being the highest quality. You should all be able to see the poll question now. And again, we'll give everyone about a minute to answer. And once everyone is done, we'll share the results and move on to patient solutions. I see just a few more coming through. So quite a few of you rated 4, and second running close to that, 5 and 3. Matt, what do you think of these ratings?
Yeah, I think a 4 is about what I expected. And I think, we're going to have some good information to maybe address some of that. And, there are some folks that are, trying to do connections on cellular that could struggle. And so I think, sort of going back to setting expectations with folks and being able to have access to reporting like we have that can help you identify folks that might have issues. I think those could all be very helpful to push uh, um, those ratings to a 5 for you.
Thanks, Matt. And thank you everyone for participating with our questions today. And we will continue with our webinar. Telehealth visits don't have to be basic video conferencing. In fact, there are many different types of workflows. Matt, would you mind walking us through an example of one?
Yeah, I mean, we have all kinds from on-demand flows to links that are waiting rooms to kiosk mode. Kiosk mode might be a great way to load balance across locations or address populations that aren't don't have access to the technology. There's group visits. There's all kinds of different workflows if you invest in a more enterprise grade platform. So here's an example of even a visit with the ability to transfer. So imagine patient schedules their own appointment, all of the reminders, all of the support. We have instant technical support available within 15 seconds for patients. Mend can handle all of that. It's time for their visit. They click a link, put in their date of birth, any device, they're connected, low bandwidth connected even. And let's say maybe somebody from the front desk or an MA joins the visit, checks them in, reviews all the documentation and digital forms that were also completed on Mend. And maybe, says, hey, the provider, is running 10 minutes behind and I'm going to go ahead and transfer you over to their queue. They get transferred to the provider. They see the provider. They have a great visit. And then maybe they even get transferred to somebody who handles the checkout, gets them doctor's notes in the visits, schedules any follow-ups. So, this is a lot of what I'm describing can be done for in-person as well. And so you can mimic these same workflows in a virtual environment and create those same experiences, utilize some of those same processes. So there's a lot of capability and options for healthcare organizations to explore.
I don't recall my doctor ever asking me for my email address. Matt, what do you recommend as healthcare pivots towards digital health and hybrid care models?
Yeah, so in the previous section, we talked about the risk factors that we developed around connectivity. And if you've seen this data before in previous presentations from Mend, this is updated. We've overhauled how we calculate reachable versus unreachable now. So not only are we looking at, are they providing the contact information? Is the contact valid? Did the email bounce? Did they disable email text from the system? Did they reply stop to a text? So is there anything that's preventing us from reaching this patient? And you can see 94.7% of patients on Mend have a valid contact information. So if you are an organization that said our no-show rate is between 10 and 15%, if you want to get and drive into the single digits, you can't be missing 5% of the contact information, right? So you've got to have great processes for making sure that you have valid contact information. Now we have entirely new internal reporting. We can look at your reachability for telehealth, for digital forms. We can look at it across the board. We can give you a report. We can say, here's everybody that's unreachable so you can fix it. We can even show you in the telehealth appointment risk report who is at risk of connecting. We can tell you this person's a 5, and the reason they're a 5 is because they're unreachable, and we can tell you that out in the future. So for those that want to make a dent in their telehealth program, this is low-hanging fruit that we see. There are organizations that do this extremely well, that don't have issues, and they're the ones that are likely going to be operating in the single digits for no-show rates. So across the board, we 87% of the time we have a mobile number, and 96% of the time we have an email address. So we're seeing a lot of email addresses, but for reachable mobile numbers, again, this is low hanging fruit. The more phone numbers, the more mobile numbers you put on file, the better engagement, the better attendance to these visits you're going to have, because emails can get missed, but 90% of text messages are read within 3 minutes. So really looking at the contact information. And if you're a Mend customer, we can pull this data for you with precision and really help you optimize your program now with some new reporting we have available.
A provider's experience when using a telehealth platform is important. What's one of the ways the best platforms handle this while still keeping it easy for providers?
Yeah, so a lot of providers need a single screen experience. They want to have the video of the patient, but really they need to be accessing the records. They need to be accessing notes and the medications, allergies, previous lab results, documenting new information for a new encounter. So picture in picture is definitely a feature that you're going to want as part of your telehealth program to allow providers to handle their documentation in session while still creating that engaged experience with the patient. And then we're creating even newer experiences and newer innovations for single screen experiences where we can embed Mend side by side with the EHR to access everything in Mend. So not just the video encounter being a single screen experience, but we're making all of Mend into a single screen experience. So you can have the providers can have access to the chart, or staff can have access to the chart. And then on in another panel on your computer, you can have access to Mend in a secondary panel, and everything that we have from forms to scheduling to telehealth. Are they online? Join a session, so on and so forth. So, picture in picture is key today. And then we've got some other innovations that we're working on to create more user-friendly single screen experiences for providers and staff.
Mend is a very data-driven organization. Matt, how does Mend share video visit connection data with customers?
Yeah, so we store all of the connectivity data. So all the audio bit rates, all the video bit rates, any errors. So all the connection times, if there's packet loss, everybody that was in a session, did they disconnect and then reconnect, everything is stored. So this information is available at the appointment level. So if you want to drill in on a particular appointment, you can drill in and see if there were any issues, what did the bandwidth look like for the patient, provider, so on and so forth. Then we aggregate this data. So there are a number of different reports that are available in our portal that allow you to look at every user's connectivity, their average bandwidth. We showed an example of that in some provider reporting in an earlier slide. And then we've got a higher level visual reporting that we've built out that account managers are providing to customers. We're going to look at all kinds of data for you. So going back to tracking and measuring goals, we're pretty much going to do this for you. And not only that, we're going to tell you the benchmarks for where you should be relative to other Mend customers. So we're going to be looking at no-show rates. We can look at bandwidth. We can look at your wait times relative. We can look at staff bandwidth quality relative to other Mend customers, patient bandwidth quality relative to other Mend customers, patient satisfaction ratings relative to others, provider satisfaction ratings relative to others. So we're able to provide, the reachability. Is there an issue? Where is the issue? Are we missing mobile numbers? Are we missing emails? So we're going to be able to give you a level of reporting that you have probably never seen for your telehealth program, to understand where you are excelling and seeing success, and then where are the opportunities to improve. And then our team is going to be able to guide you if there are opportunities to improve. Our team is going to be able to pinpoint and guide you to where the low hanging fruit is, and where we recommend as solutions to help you drive no-show rates down further, or achieve any of those objectives that you're looking to achieve.
Nudging patients has become a crucial part for reducing no-shows. Can you explain how Men improved its capabilities?
Yeah, so there's all kinds of use cases for this, and you see some listed at the top. But being able to nudge a patient, and we have some other ways to do this, and we have some automated nudges that are in the session. Having it, just because a patient isn't online doesn't mean that has to be a no-show, right? You can go into our system. The patient will actually be defaulted right there, and you can send them a nudge to say, hey, I'm ready for the visit. Let's jump on the visit. Just to even connecting to the visit as a provider sends an automatic nudge to the patient to join. So nudging is definitely something that can help more visits happen successfully that you can do through our system. And then it is also a way to get links to other folks that might need to join the session, whether you need to get a parent, spouse, maybe a sign language interpreter, a translator, another provider, somebody who's learning and training to become a physician, all kinds of different use cases. So, we have those capabilities to nudge, and then also send links or sort of give another nudge to try and help that visit happen.
Speaking of bringing in third parties into a session, how is Mend innovating the patient experience and the provider's capability?
Yeah, so another way to nudge might be to call the patient, tell them, hey, can you, it's time for the visit. Can you get on? Or you may need it as a backup to finish a visit. Maybe they're on a weak cellular connection and it disconnects, their phone runs out of battery, whatever the situation may be. Having that audio, that capability to dial somebody, can help make sure that the visit happens and reaches a conclusion. To even being able to bring other participants into a session. Again, we talked about maybe bringing a parent, a spouse, or somebody else. Translators are a big use case. Bringing a translator into a session, that organization that you're contracted with to provide on-demand translators over the phone, you can have them set up on speed dial and just click the language that you need for that particular encounter. Maybe you want to bring a scribe in. So there's a lot of different use cases, but we have that dial and that dialer capability along with that audio video capability to make sure that providers have everything at their disposal to be able to provide a high quality of care to patients in a virtual setting.
Patient satisfaction is often a struggle when it comes to virtual visits. Can you explain one innovative way Mend improves patient satisfaction?
Yeah, so might not have caught it, but on a few slides before, we had a telehealth a dashboard. Well, on that dashboard, we compare your average wait time before the provider joins in a video visit to what the Mend average wait time is. Well, the Mend average wait time is about 13 and a half minutes. So that's a lot of time. That's a lot of time to be looking at a screen that says, your provider will be with you shortly, or somebody will connect shortly, right? That's a lot of time that could be used to offer something valuable. And that's what the enhanced virtual waiting room experience does. It provides a lot of different content so that people can be healthier, they can learn. Maybe they want to learn to meditate, heart health, healthy eating. You can upload your own content and have information about your organization, what you're doing in the community, how you're having an impact, other services that you offer. You can really leverage this 13 and a half minutes to create a brand new experience while somebody is waiting. And what we see is higher patient satisfaction ratings. So in October, our patient satisfaction rating across the board was 95.2%. So we're seeing very high patient satisfaction ratings, and it's because of experiences like these. And these types of experiences, I think people value. It says, oh, this is an organization that cares. They're giving me information that is maybe going to help me be healthier or is going to help me learn something new today. And so this is a very unique experience that we have, and we're doing something valuable and something innovative in leveraging that time that patients spend waiting before their provider connects.
We all know that technology doesn't always work perfectly all the time. What has Mend developed to give customers a solid plan B?
Yeah, so by the end of this year, we're going to be the first telemedicine company that offers a telemedicine software as a solution to have a built-in backup plan. So we actually have, in a completely separate environment, separate from Mend, we're going to have an option to have a backup visit. So just as an example, sometimes what can happen is maybe the patient isn't able to connect on a platform, and you try another solution and that one works. Well, sometimes if you go into your first encounter and you get a message that pops up right away to allow or block, and let's say the person is like, oh, I don't know what this is, let me block this, and then, oh, this is for the telemedicine visit. Now how do I unblock it? Or maybe they misclick or something like that happens, or they're on a cellular connection, they're in a rural area, and the connection is just not smooth. There's a number of these different scenarios that can happen. Well, we're providing a backup option. All the bells and whistles have been stripped off. It's just a video connection. You put an email address or a phone number in, it sends the person a link, and you can connect using any device over the web. So this is going to be available to providers from within our platform if organizations want to make it available, or in the event that something else was causing a slowdown or any sort of interruption. This is a completely separate system and a completely separate infrastructure that operates independently of Mend that will be a clear backup plan. So for those that get accredited for telehealth, contingency planning and those disaster recovery scenarios and simulations have to be accounted for. But we're just building that right in. Or maybe somebody misclicked, they blocked access to camera and mic on accident. And it's not easy to go in and find how to unblock that in a browser. Whatever the case may be, they're on a bad connection, we're going to have a built-in backup that'll be releasing by the end of the year, built right into the platform to ensure that your organization is able to help as many people as possible.
Before we get to the Q&A portion of today's event, our audience may or may not know that Mend is a complete patient engagement platform for in-person, virtual, or any type of visit. Matt, can you explain this further for our audience today?
Yeah, so we've been talking a lot about telehealth, but we can help healthcare organizations really implement a full patient engagement strategy across in-person visits and virtual. So I'll say that again, in-person visits or virtual. So our patient self-scheduling works for in-person visits and virtual. Our appointment reminders, the ability to change appointments so that patients can self-change, digital forms, our payment solution, which is incredible, which is an automated mobile patient pay solution that can work across any type of visit. Then, of course, we also excel at telemedicine as well and being able to facilitate a virtual visit. So it's really one-stop shopping at Mend, and there's a lot of different ways we can add value to your organization and help you modernize some of these touch points with patients.
In our white paper section, we have brand new content titled Patient Payment Trends in Healthcare. For those in our audience interested in this content, just go to mend.com, click resources, and then click white papers. And with that, Matt, let's jump into the questions. And as a reminder to our audience, Zoom has the Q&A option in the toolbar to make easier for us to answer your questions. Matt, I think we have our most popular asked question, which is, will we be getting this webinar recording and deck afterwards? Yes, you guys will be. And also, I think I saw something else relating to that. The recording, we do post this recording of the webinar to our website as well.
Yeah, so the recording and the slides should go out to anybody that attended today. So within the next 24 hours or so, you should receive that.
Thank you for clarifying that. And I do just want to note, there are quite a few questions today, which is great. Awesome. We love many questions, but for whatever reason, if we don't answer a question today, Matt keeps his email open at all times, matt@mend.com, so you can ask him your questions there. Let's see here. We have an anonymous question. Does Mend provide a client workflow on how to connect to telehealth session that we can share?
Yeah, we do have, first, you want to make it easy, right? And we, can't make it any easier. You click a link, date of birth, and that's it. So you want to remove all the friction. But yes, we do have, we've had customers put together tip sheets or videos, and we can help put these things together. And then we can even include them at the end of the text message for the visit. Here's a video on what to expect, or here's a link to a tip sheet. And we can put those links at the end of the text message, or at the top of an email, at the bottom of an email, but we can include that additional content. So as they're being reminded for their appointments, and they're getting the links for their appointments, they can also access some content on what to expect, frequently asked questions, however you want to develop that. And we'll certainly make some recommendations and help you set that up.
Another anonymous question here, kind of a longer one, so I'm going to try to summarize it for you, Matt. They would like to know a little more about the 150-day PHE extension. What specifically is currently waived till January 11th, and then end future under 150-day extension?
Yeah, and it's a little bit of a longer question that also references the Ryan Hate Act, which is the regulations around prescribing controlled substances. And there have been some changes, or some talks of some changes there. So the Center for Connected Health Policy would be a great place to go for that. Also, the the Center of Connected Health Policy covers all of the state regulations. And so sometimes states regulate the prescribing of controlled substances a little bit differently. So when it comes to controlled substances, I'm not a lawyer, Mend is not a lawyer. I think you may want to look for some legal assistance there with anything relating to that. And in terms of in-person assessments relating to the prescribing of controlled substances and saying, well, some have been waived until January 11th, PHE, and then there's a 151-day extension. I mean, the 151-day extension, in a lot of the cases that I've seen, the in-person requirement may also be waived during that 151-day extension. But again, when we're talking about controlled substances, it's probably best to get some legal advice there.
Jennifer is asking, it looks like 2 questions here. Are you aware of a telehealth triage or algorithm or suitability eligibility tool to assist with identification at time of appointment if patient should be live or telehealth visit?
Yeah, so our patient self-scheduling process and product has a set of questions that can be designed like a triage to not only determine, essentially what we're doing is we're trying to determine what appointment type is appropriate, who's the right provider based on age, insurance, state, other factors. And so, yes, our patient self-scheduling product can help navigate somebody, maybe it's based on conditions and more of a clinical protocol in addition to insurance, age, some of these other factors, geography, but we can design those triages. In some cases, staff use it as a tool to route and schedule and sort of manage it that way, or for patient self-scheduling where we can determine and get them to an in-person visit or a virtual visit. So yes, our patient self-scheduling can direct to the appropriate visit, whether it be in person or virtual.
And question 2 from Jennifer, is there data on what type of symptoms are successfully treated via telehealth versus what symptoms are best seen live?
Yes, I think probably the best resource to find that information is there is likely an association, a medical association of some kind that maybe is for a particular specialty, or maybe like the AMA, for example, and they will publish that type of guidance on suitability studies, things of that nature. So I would say the best place to start would probably be, for your specialty or what have you, go to one of the larger medical associations, and they will likely have that guidance for telehealth. And many of them put out, as the pandemic started and telehealth entered the scene in a big way, a lot of them started publishing that guidance back in 2020.
Another anonymous attendee is asking, is Mend good for clients that are non-English speakers?
Yes, so we support 8 different languages today. So all the most common languages spoken throughout the United States. So everything, text messages, emails, the website, tech support, everything can be delivered in those languages. So we definitely have that capability. And then as you saw, we have the dialer that can bring in translators into the visit for any live interpretation services that you need. So yes, we support many different languages, and that's going to be key to making sure that visits happen successfully on whatever platform you're using.
Another anonymous attendee asked, with virtual waiting room experience, could you have a client complete some paperwork like a questionnaire?
We actually send the paperwork out in advance of the visit. We average an 86% completion rate on those forms. So they actually receive the forms. We have a series of reminders to complete the forms. If they have not completed, then we can actually force them before the visit. So they'll see and have to complete those forms. And then additionally, you can actually assign a form in a virtual visit on our platform, and you can open it automatically on the patient's screen so they can complete it in session. So if you needed somebody, an MA or somebody needed to get the rest of the paperwork, or maybe you wanted to have some sort of exercise that they do during a therapy session, we'll send it in advance. We can make sure they complete it before the visit starts. And then if all else fails, you can push a form to them right in the video visit.
Another question here from an anonymous attendee. They're interested in seeing how MEND allows a patient to connect in same session to other points in our system of care. So say the patient comes in the front door, they're greeted, they go to the desk to confirm their basic information, appointment, perhaps verify insurance, etc. Then they're sent to the nurse, prepped for their appointment. They see their doctor, provider, pharmacy, and then maybe to the scheduling desk or billing office. Does MEND help move a patient virtually through this process?
Yes, and we showed that slide. So when we send out the deck and the recording, I was about halfway through the presentation, slide 17. Yes, you can mimic those exact workflows. And so as you move somebody along, you can transfer them to a specific person, or you can move them to a queue. So for example, if you were going to transfer somebody to checkout, right? Well, you may have a couple people and the first person available can pick up the next person in the queue. It's all organized by who's been waiting the longest. Whereas if you're front desk transferring to the provider is probably known, they're scheduled with this provider, you may transfer them right to that specific provider. So you can move them along, you can set up the queue however you want, and we'll help design and set that up for you. And you can transfer to specific people or a queue where somebody can process the next available patient.
Another anonymous attendee is asking, is there an additional cost to add videos to the waiting room?
There's no additional cost to add videos to the waiting room. So, there are potentially some additional costs for the enhanced virtual waiting room experience, but not beyond that. And the costs are minimal. And there's definitely great options there and great pricing available for that experience. But then it's all inclusive, and you can upload different videos and have different content. And we'll try and take another question or two, but just to reiterate what Brooke said, my email address is right on the screen there, matt@men.com. So we have a ton of questions today, a ton of participation and attendance. So if we're not able to get to all the questions, don't hesitate to email me, and I will definitely get back to you if you have a question that we don't get to.
Lisa is asking, does this platform integrate with EHRs, or is it meant to stand alone?
Yeah, we can integrate with over 81 different EHRs. So all of the big names. You definitely want to integrate it. You don't want to have staff doing any duplicate data entry of any kind. A lot of healthcare organizations are facing staffing issues and problems in that regard. So you absolutely want to integrate it, and we can keep everything synced up. And if you want to offer things like patient self-scheduling, we'll set up a bi-directional workflow so we can allow patients to automatically schedule, make changes. Or you may want to have staff book a follow-up visit right in session, right in, while they're in a video visit, and then we can sync all that up back to the EHR. So we have a lot of integration capability.
Okay, and I think we have time for one last question here. Anonymous attendee is asking that you said telehealth can improve compliance and outcomes. Are you able to elaborate a little bit more on how?
Yeah, I mean, the average in-person no-show rate, you can look in different studies. The average in the United States is 23% for an in-person visit. Our average no-show rate for telehealth visits is 8%, and there have been other studies that have been published online in the NIH, sort of studying compliance and no-shows in those situations around telehealth. And that's a big delta, right? 23% for in-person to single digits for telehealth. There's a big opportunity to drive compliance, and which should ultimately improve outcomes. But there's a lot of different studies and folks that have looked at that. So there's a lot of different research online.
Thanks, Matt, so much for all your responses there to everyone's questions. And thank you everyone for tuning in and joining Matt McBride and myself today. Always a pleasure discussing this with you, Matt, and we hope you all tune in again next time. Bye, everyone.
Thanks, everybody.